Hands up, then you can start talking. Look here in the green.
Okay. Yeah. Hello, I am Dr. Gautam, Dr. Ashish Gautam, Head Department of Surgery, including minimal assist, bariatric and gastrointestinal surgery at Yashoda Super Specialty Hospital, Ghaziabad. Dear friends, today we are talking about the childhood obesity. And it is, I should say, it is an endemic situation going to happen in India. About 14.4 million of uh, our children are becoming obese, and we are next to China only in regarding the childhood obesity. The childhood obesity regarding the child obesity is multifactorial. Basically, it is genetic, it is environmental, and it is also related with our daily lifestyle. As we can see and we see it daily that our day-to-day activities of our kids has come down a lot. The TV viewing has increased a lot, internet viewing has increased a lot, but outside activities are decreasing day by day. And this is our responsibility as the parents, as the teachers, as the doctors, and social responsibility of schools also, I should say, that they should come forward to prevent this menace. The childhood obesity not only creates problem in the childhood and teens, but it also increases the problems when the kids grow up. They can suffer from osteoarthritis, type 2 diabetes mellitus, and also hypercholesterolemia and cardiac disorders, in addition to other psychological disorders which they feel in their day-to-day life. So the obesity is a disease, and we must see in that way exactly. So what are the factors which causes the childhood obesity? The causative factor of childhood obesities are, it is multifactorial. They are the factors which are related with the genetics. The factors which are more important nowadays are more of environmental factors, lifestyle factors. Environmental factors, we say that more of our restriction to our kids to home, less of activities, especially the playing, and more of TV viewing. One very important point I want to tell you, that when the kids eat while seeing the TV, they eat more, and they also have the problem of having high calorie intake and high calorie diet. Second thing, the having a lot of sweeteners or sweetened drinks, or I should say the flavored drinks to have in the home, which is more common nowadays. And I should also tell you one thing, that juices also comes into this category. I always advise my patients or my fellow people or other, or whenever I go to the lecture in the schools and other places, to avoid juices. Have a wholesome fruit in your diet. That is it. And another important factor in environmental factors, that less of space for the kids to play. And when we were young, we were having so much of space to have that, too much of the space to play, and we do a lot of outdoor activities rather than indoor activities. So we have to promote of high, more and more of activities. Any child more than 4 years should have minimum 30 minutes of activities, and whenever you increase the age, then increasing the age must have minimum 60 minutes of activities per day. That make it a rule at your home. Regarding the childhood obesity, when we come to the definition of childhood obesity comes that it is having the obese is means the 85 percentile of across her age and sex relation. Second, morbid obesity comes when it comes to 95 percentile of that age and sex pattern. So it is little bit different from the adult obesity, because the BMI is age and sex specific as the kid grows. So we have to see that where our kids are standing. Are they are getting overweight, obese? This is very important factor we have to learn about this. Another important point when we goes to the regarding environmental, and then is the one is the genetic, then is the environmental, and then is another is that our social milieu. And when you see when I say about the social milieu, we can see that as per se in the social life, our kids are getting more and more alone, more and more lonely. We are having these days the nuclear families, the mother and parents and two kids. The usually the parents are working, the kids are stuck at home even after their schools are finished. So we have to take out time to have the increased activity to reduce the child obesity. We have this is the responsibility of parents, social social activists, as well as the schools. Now you can see they are already burdened with so much of excess of academic activities that they are not having too much time. Even in the schools, they don't have many of the schools and others they are not having a outdoor activities for a long period. The point is that what I feel as a bariatric surgeon that every school should have minimum 60 minutes or 45 minutes of outdoor activities for their students. That is must be mandatory. Another point to how we can reduce the burden then becomes about the diet of our kids. As we can see, the diet is day in and day out is becoming more of a frozen snacks, packed foods, lot of pizzas and burgers, and we are getting away from our traditional Indian recipes, which were having a better milieu of amino acids, fats, and non-saturated fats. So we are getting away from these diets and we are having more of a Western diets. As far as Indians are concerned, we are more prone to obesity. And when we are of having Western diet and Western influence of our diet. So two things we can do minimum in our home that we should increase the taking of water rather than sweetened drinks. And cut गया.
Can't connect. I'm connected with my internet. Sorry. So next time हिंदी से शुरू कर सकते हैं. हिंदी.
Okay.
My audience हिंदी.
Okay.
And when you start ना just say sorry the internet went off. I'm ending this video. We'll go again.
सारा का सारा.
नहीं starting you can start in Hindi.
Okay. और ये वाला पीछे वाले का क्या करेंगे? Add on कर देंगे उसको.